In a situation where I notice my colleague is treating a patient against the established guidelines, the first thing would be for me to seek more information about it. I would try to understand why my colleague is not treating according to the guidelines. One has to understand that guidelines are can be it's not necessary to follow the guidelines at all times. Professional judgment of doctors needs to be used while implementing the guidelines or while prescribing treatment. Sometimes it is different from the guidelines as mentioned because the guidelines may not be strictly applicable to the patient in question, or the patient may have refused treatment according to the guidelines. Sometimes there are updated guidelines and we are not aware of the updates. So I would try to first talk to the colleague and understand why this treatment was prescribed and when it was not according to the guidelines. Of course, it depends upon whether this clinical situation is an emergency or a non-emergency. So I would definitely ask the person if the situation was a non-emergency, and I would definitely ask in a very academic way, in a very polite way. Maybe I would frame the sentence like, "I'm struggling to understand why you treated the patient in this way when the guidelines says the treatment is uh, to be provided in some other way." And hopefully I would get an answer from the consultant which would explain the difference in the treatment in a very simple way that I would be able to clearly understand. If that happens, then the matter ends there. However, if I don't understand the rationale, I would try to read up on my own. Maybe I would read up before I go and talk to the consultant, but if his explanation does not make sense, I would try to read up even more and talk to other senior consultants in the team and try to get an understanding of why this treatment was followed. If the treatment does not make sense despite extensive reading and talking to people, then I would definitely raise a concern, because the most important thing at all times is patient safety, which needs to be, which cannot be compromised with under any circumstances. So I would try to raise the concern within the team and resolve the issue. If it does not get resolved within the team, then I would have to raise the issue with appropriate authorities like the clinical director, perhaps. However, if the situation is an emergency, then I would have to follow the instructions of my senior colleague, but I will keep a note of my disagreement with the treatment that was advised. And we have to understand that while we are extremely supportive of our colleagues, and we have to remember the fact that guidelines do get updated, and every guideline does not need to be followed for every patient. Professional judgment needs to be applied while prescribing treatment for every patient. But the most important thing at all times remains patient safety, and we should not lose sight of that just because a person is much more senior or is very extremely qualified. The priority remains patient safety. We should not try to cover up or protect the reputation of our colleagues at the expense of the safety of the care that the patient receives.